Hi, I'm Taryn Grome, editor of PharmaVOICE magazine, on the floor of the 2010 DIA annual meeting, and I'm here with Dr. Drew Kilpatrick of Kendle.
Dr. Kilpatrick, welcome to the PharmaVOICE Editor's Take program. Can you please define first what electronic adjudication is?
Well, Trialese is our web-based solution for independent electronic adjudication for endpoints in clinical trials. In addition, Kendle has recently introduced a separate module which allows us to assist investigators in selecting the most appropriate patients for their clinical trials.
And how does this work as a patient eligibility tool?
Well, certain diseases and conditions where the diagnosis is extremely difficult, such as lupus or MS, the diagnosis is extremely difficult because there's no diagnostic tool to allow the diagnosis, or alternatively diagnosis is made through a number of symptoms, or alternatively it's by exclusion of symptoms. So what we have done is to introduce Trialese, which allows the independent review of screening data by external experts, and that information then is fed back to the investigator either through an IVRS system or an IWRS system, and that then will tell the investigator, inform the investigator that the patient is eligible for inclusion into the study.
Now, what are the primary benefits of electronic adjudication for customers?
The reason that we introduced Trialese, and in particular this patient eligibility model, was to improve the homogeneity of the patients that are in the clinical trials, especially those studies which have difficult diagnosis. Our reason is that if you improve the homogeneity of the population, you will improve then the signal to noise in the primary measure of efficacy or secondary measure of efficacy. If you do that, then it makes it easier to demonstrate a clinically significant difference either between active treatments or against placebo.
Thank you very much for explaining a very important aspect of the industry.
Thank you.